5 years after COVID-19 emerged from China, turned into a global pandemic and killed 7 million people, there is a new virus that is quickly spreading through the country and the world. The virus, which has been identified as human metapneumovirus or HMPV, has seen cases spiking across northern Chinese provinces this winter. It is a respiratory disease that causes flu or cold-like symptoms but can increase risks or lead to more serious complications like bronchitis or pneumonia. Cases have been surging in northern China, particularly among children. The country's Center for Disease Control has pushed back against social media claims of hospitals being overwhelmed and fears of another COVID-like pandemic. They have pointed out that respiratory infections tend to peak during the winter season anyway. At the same time, authorities have urged people to take precautions. The World Health Organization has not flagged the situation as a global health emergency just yet, but the rise in cases has prompted authorities to bolster monitoring systems. First identified in 2001, HMPV is a single-stranded RNA virus that spreads through respiratory droplets or contact with contaminated surfaces. Cases have been previously identified in various countries, including the United Kingdom. Its symptoms include cough, fever, nasal congestion, and fatigue, with an incubation period of 3 to 6 days. HMPV can lead to more serious illnesses like bronchitis and pneumonia among the elderly, very young children, and people who are immunocompromised. There is no vaccine or specific antiviral treatment for HMPV. Treatment primarily involves managing symptoms. While HMPV and SARS-CoV-2, which is the virus responsible for COVID-19, belong to different viral families, they do share striking similarities. When it comes to transmission, both spread through respiratory droplets and contact with contaminated surfaces. Both primarily target the respiratory system, causing mild to severe infections. The symptoms include fever, cough, sore throat, wheezing, and shortness of breath. Children, the elderly, and immunocompromised individuals are at greater risk. And when it comes to prevention, hand hygiene, wearing masks, and social distancing can help curb transmission. There is one big difference that experts are pointing out. COVID-19 was a new disease which had never infected humans before, driving the pandemic-level spread that we witnessed from 2020 onwards. On the other hand, HMPV has been around for several decades, and there is a level of immunity in the global population from past infections. So even though we are starting to see HMPV cases beyond China, it's not time to press the panic button just yet.